G'day, folks. I'm Dr. Zoe Mitchell, and I've been working with blokes just like you for over 20 years now. Today, we're going to have a proper yarn about something most men don't talk about at the Barbie. But trust me, it's bloody important. We're talking about your prostate and what happens to it when you're having a bit of solo time on the regular. Now, before you click away thinking this is going to be awkward, stick with me for just a sec. I had a patient come into my clinic in Brisbane last month. Let's call him Barry. He's 62, been married for 35 years, and he sat down looking more nervous than a long-tailed cat in a room full of rocking chairs. He goes, "Doc, I've been reading stuff online, and now I'm worried I've done damage to myself." Turns out Barry had been masturbating daily for decades, and some dodgy website told him his prostate was probably ruined. Here's the thing, though. After examining Barry and running his tests, his prostate was in fantastic nick. Better than most blokes his age, actually. So what's the real story? That's exactly what we're going to unpack today. Because there's a heap of misinformation floating around, and you deserve to know the facts. Let me start with something that might surprise you. Your prostate, that little walnut-sized gland sitting just below your bladder, is actually a bit of an unsung hero. It gets overlooked compared to more famous body parts. But mate, it's absolutely essential for producing the fluid that protects and transports your sperm. And here's the kicker. The health of this little legend is directly connected to your sexual behavior, including masturbation. Now, I know some of you grew up being told all sorts of rubbish about this topic. I've heard everything from "you'll go blind" to "it'll fall off." One of my patients, a 73-year-old retired farmer from out Toowoomba way, actually laughed when he told me his mum used to say that to him back in the 50s. Fair dinkum, we've come a long way since then, but there's still so much confusion. So let's get into it. When you ejaculate, whether through masturbation or sex with a partner, your prostate is doing some serious work. It's producing and releasing prostatic fluid through your urethra. This isn't just happening once and done. If you're masturbating daily, you're essentially putting your prostate into a regular rhythm of production and release. Think of it like a factory that's running consistent shifts rather than sporadic bursts. What happens to the gland itself? Well, when it's regularly stimulated, it can become more efficient at its job. The prostate ramps up its fluid production to keep pace with demand, making sure there's enough seminal fluid ready for each ejaculation. This increased activity is generally not harmful. In fact, for most blokes, it's completely normal. But here's where it gets interesting. And this is something I always explain to my patients. Your prostate can temporarily swell a bit due to all this activity. This enlargement is benign, nothing to stress about, but it can sometimes cause a feeling of fullness or pressure in your pelvic region. This is especially true if you're not giving the gland enough rest between sessions. I've had fellas come in thinking something was seriously wrong when really their prostate just needed a bit of a breather. The good news is that over time, your prostate generally adapts to this routine. It's a remarkably resilient organ. The cycle of increased activity and recovery becomes normal for the gland as it adjusts to daily stimulation. Your body is pretty clever like that. Now let's talk about blood flow, because this is something a lot of blokes don't think about. During ejaculation, there's a significant increase in blood flow to your entire pelvic area, including your prostate. This rush of blood causes mild swelling, which is a completely natural response to heightened activity. After you're done, your prostate doesn't immediately snap back to its pre-activity state. It takes a while for the blood flow to decrease and for the tension to dissipate. This swelling is often so minor that men who masturbate regularly don't even notice it. But it's actually a good indicator that your prostate was actively engaged during sexual activity. Over time, with repeated cycles of swelling and relaxation, your prostate can become more sensitive. Some men notice a slight throbbing sensation in the pelvic area after ejaculation, or a feeling of fullness. While this isn't harmful in itself, it's worth keeping an eye on. Here's when you should pay attention, though. If you're experiencing swelling that persists and becomes uncomfortable, that could indicate underlying issues like irritation or inflammation that need medical attention. Don't be a hero about it. Come see your GP or a urologist. We've seen it all. Trust me. Right. Now for some genuinely good news, and this is backed by proper research. One of the most notable benefits of regular masturbation is improved prostate drainage. Your gland releases fluids through ejaculation, and without regular release, these fluids can build up and potentially cause discomfort, or even increase infection risk. A study published in the Journal of the American Medical Association followed nearly 30,000 men over 18 years. The researchers found that blokes who ejaculated 21 or more times per month had a significantly lower risk of prostate cancer compared to those who ejaculated 4 to 7 times monthly. We're talking about a reduction of around 20%. That's not nothing, folks. By regularly emptying your prostate, you're essentially keeping it clean and reducing the risk of prostatitis, which is inflammation of the gland that can cause discomfort, difficulty urinating, and sometimes even fever. Think of it like clearing out the pipes. Regular maintenance keeps everything flowing smoothly. But, and this is important, there's a delicate balance to strike here. Regular drainage is beneficial, but overdoing it can put excessive strain on your prostate. The gland can become fatigued or develop mild inflammation if it's continuously producing and releasing fluid without adequate recovery time. I've seen this in my practice, particularly with younger blokes who are going at it multiple times a day. Everything in moderation, as my old nan used to say. Now I want to address something that came up with another patient of mine recently. Let's call him Doug. He's 60 years old, been masturbating about 4 times a week his whole adult life, and his urologist was genuinely impressed with how healthy his prostate was for his age. Doug asked me straight up, "So all those years, was I doing myself a favor or not?" The honest answer is probably yes, but here's the nuance. It's not just about frequency. It's about how your whole body is functioning. Doug also drinks plenty of water, eats his veggies, goes for walks, and doesn't stress too much. All of that contributes to prostate health too. Let's shift gears and talk about hormones, because your prostate doesn't just respond to physical stimulation. It's also influenced hormonally. The gland is highly responsive to male hormones, particularly testosterone, and its more potent derivative, dihydrotestosterone. These hormones are responsible for your prostate's growth and function. When masturbation becomes a regular habit, your body adjusts its hormonal processes. Frequent ejaculation can lead to slight fluctuations in hormone levels as your body responds to increased sexual activity. For some men, these hormonal shifts can result in increased prostate sensitivity. This heightened sensitivity might manifest as greater awareness of sensations in the pelvic area or mild discomfort after particularly intense activity. Blokes who already have conditions like benign prostatic hyperplasia, that's BPH or enlarged prostate, might notice this increased sensitivity more prominently. If that's you, it doesn't necessarily mean you need to stop everything, but it might mean having a chat with your doctor about what frequency works best for your situation. The consistency and composition of your ejaculate can also be affected by these hormonal fluctuations. Men who masturbate regularly might notice changes in the volume or texture of their ejaculate. This is directly related to hormonal activity and the degree of prostate engagement. These changes are typically benign, but serve as an indicator of how your prostate is adapting to regular stimulation. Now here's something I don't think gets talked about enough. Prostate fatigue. Yeah, it's a real thing. Men who masturbate regularly are in a continuous cycle of stimulation and recovery. Your prostate is incredibly adaptable, but constant pressure can lead to a state that I describe to my patients as prostate exhaustion. This doesn't happen overnight. It takes a while for the prostate to become fatigued from the constant cycle of producing seminal fluid, swelling during arousal, and contracting during ejaculation. You might notice this fatigue through a longer recovery period after ejaculation. Orgasms might feel drier or less satisfying, which can indicate that your prostate and pelvic muscles aren't fully recovering between sessions. Some men also experience a dull ache or mild discomfort in the pelvic region, particularly after masturbation. Interestingly, the effects of prostate fatigue can extend to your urinary function. The gland surrounds your urethra, and irritation or mild inflammation can affect it, leading to temporary changes in urinary flow, such as a reduced stream or increased urgency. I had a patient, a retired Sparky from the Gold Coast, who came in worried he was developing prostate cancer because his pee stream had weakened. Turns out he'd just been overdoing things during lockdown and his prostate was telling him to give it a rest. A week off and he was right as rain. These symptoms usually resolve on their own with rest. But they serve as a reminder that your prostate, like any other part of your body, benefits from balanced use. Consider incorporating rest days into your routine to alleviate fatigue and give your prostate time to recover. Speaking of recovery, let's talk about what you can do to support your prostate health beyond just managing frequency. Diet plays a huge role, folks. Consuming anti-inflammatory foods rich in zinc, omega-3 fatty acids, and vitamin E can contribute to the health of this gland. Staying well hydrated is equally crucial. Zinc is essential for immune function, protein synthesis, and prostate health. Zinc deficiency has been linked to prostate issues, including an increased risk of prostate cancer. You can get zinc from foods like pumpkin seeds, whole grains, and shellfish. Next time you're at the servo grabbing a snack, maybe swap the chips for some mixed nuts. Yeah? Selenium is another important mineral, packed with antioxidants that protect prostate cells from damage caused by oxidative stress, which can lead to cancer and chronic inflammation. Brazil nuts are an absolute ripper source of selenium. Just 2 or 3 a day gives you more than you need. Omega-3 fatty acids, found in fish like salmon and sardines, help reduce inflammation throughout your body, including in your prostate. I always tell my patients that what's good for your heart is generally good for your prostate too. The two are more connected than most people realize. Now let's talk about mild prostate irritation, because this can also be caused by daily masturbation, especially if it's intense or prolonged. Your prostate contracts to forcefully expel seminal fluid during ejaculation. When this process is frequently repeated, it can lead to irritation or heightened sensitivity of the gland. The symptoms of prostate irritation vary. You might experience a persistent feeling of discomfort or fullness in your lower abdomen or perineal area. That's the bit between your scrotum and your backside for those playing at home. Some men experience mild burning or tingling sensations after ejaculation, which could indicate the gland has been overworked. This irritation can sometimes progress to prostatitis, an inflammation of the prostate that can cause symptoms like pelvic pain, difficulty urinating, and in some cases, fever. While prostatitis is more commonly associated with bacterial infections, it can sometimes be triggered by lifestyle factors, including excessive prostate stimulation. To reduce irritation, approach masturbation with care. Using appropriate lubrication and avoiding overly aggressive techniques can help protect your prostate. Also, giving your gland time to rest between sessions is important. If discomfort persists or worsens, consult your doctor to rule out other issues. Don't sit at home Googling symptoms at 2 in the morning. That never ends well for anyone. All right, let's zoom out and look at the long-term picture, because I reckon that's what most of you really want to know about. What does decades of regular masturbation mean for your prostate health down the track? As I mentioned earlier, regular ejaculation is associated with a lower risk of prostate cancer. By ejaculating regularly, your prostate can expel potentially harmful substances, including carcinogens. The research is pretty compelling on this point. Men who ejaculate frequently, whether through masturbation or partnered sex, may have a reduced risk of developing prostate cancer later in life. But, and there's always a but in medicine, the benefits and risks of frequent ejaculation need to be weighed carefully. For men who already have conditions like BPH or chronic prostatitis, daily masturbation can sometimes exacerbate symptoms such as urinary issues or pelvic pain. The cumulative stress on the gland can also lead to irritation and sensitivity over time. The key is adopting a balanced approach. Listen to your body, take rest breaks when needed, see a doctor if something doesn't feel right. By doing these things, you can maintain prostate health and resilience well into your later years. Now, I want to spend a bit of time on exercise and hydration, because these are absolute game changers that don't get enough attention. Physical activity is essential for maintaining good prostate health. Exercise improves cardiovascular health and promotes blood circulation throughout your entire body, including to your prostate. Optimal prostate function depends on good blood flow, which ensures that oxygen and nutrients are efficiently delivered and metabolic waste is removed. This is especially important for men who masturbate frequently, as regular exercise helps maintain your body's energy and reduces strain on the gland. Regular aerobic exercise, strength training, and pelvic floor exercises also reduce your risk of developing prostate problems like pelvic pain, urinary issues, or sexual dysfunction. You don't need to become a gym junkie. A daily walk, some swimming at the local pool, or even just doing some stretches while you watch the footy can make a real difference. Staying properly hydrated is equally important. Your prostate's fluid production process relies heavily on adequate hydration. Dehydration can cause the prostate to struggle to produce enough seminal fluid, resulting in thicker fluid that can be uncomfortable. Proper hydration also helps flush toxins and maintain urinary health, reducing the risk of prostate problems or urinary tract infections. For men who masturbate regularly, optimal hydration is particularly important to ensure the prostate can work efficiently, especially during frequent ejaculation. I tell my patients to aim for about 2 liters of water a day, more if you're active or it's a scorcher outside. And no, beer doesn't count as hydration. Sorry, fellas. One of the best ways to maintain prostate health is to listen to your body and recognize its signals. Overuse of the prostate can lead to irritation, inflammation, or exhaustion. While the gland is resilient and strong, it needs time to recover after each ejaculation. Pay attention if you're experiencing discomfort, changes in urination habits, or decreased sexual pleasure. Signs that your prostate may be overworked include dull pain, a feeling of fullness in the pelvis, reduced orgasm intensity, or discomfort during or after ejaculation. If you're noticing these things, your body might be telling you to ease off a bit. Balancing prostate health requires more than just reducing sexual activity. It involves a holistic approach to health that encompasses diet, physical activity, rest, and hydration. By nourishing your prostate with proper nutrients and staying active, you can maintain prostate health for many years. It's remarkable how the gland can adapt to regular stimulation, but with proper care, it truly thrives. So here's the bottom line, folks. The secret to a healthy prostate is balance. Regular ejaculation, whether through masturbation or partnered sex, can bring significant health benefits, including improved drainage, potentially lower prostate cancer risk, and maintained sexual function. However, if done too frequently without appropriate precautions, it can lead to irritation or chronic health issues. You can enjoy a healthy sex life while maintaining prostate health by taking a balanced approach. That means listening to your body, eating a prostate-friendly diet, drinking plenty of water, exercising regularly, and allowing adequate time for recovery. I've been doing this job for over 20 years now, and if there's one thing I've learned, it's that most blokes wait way too long before talking to someone about these issues. Don't be that guy. If something's not right, come see your GP. Get your regular checkups, especially once you hit 50. A quick chat and maybe a blood test once a year can catch problems early when they're easiest to deal with. Remember Barry from the start of our chat? He left my clinic with a big smile on his face, relieved that he hadn't done any damage. He's still going strong, still enjoying his solo time, but now he understands how to do it in a way that supports his health rather than potentially compromising it. Your prostate has been working hard for you your whole life. Give it the care and attention it deserves, and it'll keep serving you well for many years to come. Take care of yourselves, gents, and I'll catch you in the next one.